Welcome, everyone. And I think it's really indeed a pleasure here at the University of Chicago Celiac Center to introduce Vanessa Weisbrod, who is a dear friend and also a dear colleague and a person who probably knows 504s more than anyone else. She is now the Chief Educational Officer at CDF, Celiac Disease Foundation, has a lot of other excellent credentials to her. But for our purposes today, she is probably the person who put the SAGE guidelines together with a lot of different people, but the initial impetus was from Vanessa. Also have Lindsay Yeagle, who's our coordinator here as well from an educational standpoint here at the University of Chicago. I am Ritu Verma. I am the medical director of the Celiac Center. But enough of us. I'm going to hand it over to Vanessa. Vanessa, kick it off for us. Thank you for being here.
Absolutely. Thank you for having me, Dr. Verma and Lindsay and Rachel. Dr. Verma was equally as much a part of the National School Guidelines as I was, and I'm always grateful to Dr. Verma for her passion and willingness to think about all of the educational pieces that go with living with celiac disease. So today we are talking about celiac disease and 504 plans at school. The slides that I'm going to be talking to you about today come as part of our National Educational Collaborative between the Celiac Disease Foundation, Society for the Study of Celiac Disease, University of Chicago, Boston Children's, and Mayo, and many more adding to the mix. So I'm excited to go through this with you today. So as Dr. Verma mentioned, we were key players in putting together the national recommendations for managing celiac disease at school. And I want to tell you a little bit about these recommendations and how they came to be so that you understand all of the thought that went into them. So in 2019, we put together a national collaborative of 12 pediatric hospitals that have celiac disease programs at them. We worked with educational associations, both public and private schools, school nurses, teachers, parents, and students. And we even had lawyers who specialized in disability law to make sure that we were actually interpreting all of these laws correctly. Throughout the process, we identified different areas where we actually had no research to help guide us in developing best practices. And so we actually paused in the middle of this to do research projects to really understand cross contact at school and what's safe and what needs more accommodations. Within these guidelines, we put together procedures for managing celiac in the school environment, preventing gluten exposures, and perhaps most importantly, setting up the actual 504 plan. So why do we have a 504 plan and how do we get there? So there are many different laws and regulations that govern families with celiac disease. First and foremost is the Americans with Disabilities Act. And what's important about this act is that it actually defines what a disability is. So a disability is a physical or mental impairment that substantially limits one or more major life activities. For every single person with celiac disease, eating, digestion, among immune function, and any other system of your body that's affected with symptoms are considered major bodily functions. And so celiac disease qualifies for protection under this law. Then we have Section 504 of the Rehabilitation Act, and this is where the 504 plan comes in. So Section 504 prohibits discrimination in any institution that receives federal funding based on a disability. And so I'm sure a lot of you right now are thinking, well, does my school accept federal funding? So all public schools receive federal funding. Then there are private schools that may receive federal funding as well. For example, during COVID, most private schools accepted federal subsidies. And because of this, they were required to follow Section 504 and accommodate for disabilities. Nearly every single college and university that's private falls under this as well, because if they accept student loans, then they are accepting federal dollars in some capacity. And so they also have to follow these laws. And so what 504 requires is that the educational programming and services that are offered by the institution meet the students' individual needs as adequately as the needs of non-disabled students. What's really important to note is that this law requires reasonable accommodations. So, for example, we can't say we want the entire school to be gluten-free. Gluten isn't allowed in the building. Those are things that we could not ask for. We have to think about being reasonable and what is actually necessary to keep a child with celiac disease safe. So there are also laws that govern food. The National School Lunch Act was designed to provide qualified students with free or reduced cost meals. And under this law, they are required to provide a gluten-free meal for a student with celiac disease. The same would go for any food allergy. They would be required, if there's a medically restricted diet, to accommodate that diet. But even if you do not qualify for free or reduced cost meals, there are now 8 states in the country: California, Colorado, Maine, Michigan, Minnesota, New Mexico, Massachusetts, and Vermont. All of these states have universal school meals, which means that they provide breakfast and lunch to all students, regardless of income level, free of charge. If you live in one of these states, an accommodation would absolutely be for a gluten-free meal, along the lines of food that any other child would offer. The Child Nutrition Act, it was a really important act that was for the first time offered financial assistance to schools to expand their breakfast and lunch services. But it was also the first time that the USDA set standards for what nutrition in schools has to look like. And what's so important about this law is that it's really the first time where we could say a gluten-free meal must meet the same nutritional standards as food served to other students. So 10, 15 years ago, when I would do 504 plan meetings with students, the schools would say, okay, we'll give them gluten-free food, but it's an apple, a banana, and yogurt. And I think we can all agree that an apple, a banana, and yogurt does not meet the same nutritional standards as food served to other children. If other students are having access to protein, to carbohydrates and grains, fruits and vegetables, a student with celiac disease should also have access to these items. It should also be a hot meal for a hot meal. It shouldn't always just be a cold salad that is offered to that student. We also have the gluten-free food labeling law, and this, of course, regulates the term gluten-free on food labels. If your school is serving packaged foods, so things that are sealed in a package that come from a manufacturer, those products are labeled as gluten-free, they of course must meet the FDA's food labeling standard. So there are different types of plans in schools, and I'm going to talk through all of them right now. So the 504 plan is the most appropriate plan for a child with celiac disease. The 504 plan will address accommodations both in the classroom as well as in extracurricular activities that are offered by the school, as well as any services and programs that are offered directly by the school. So the goal with the 504 plan is to develop a set of accommodations that allows your child to participate in all educational and social elements affiliated with the school environment. It's very, very important to note that academic performance is not a factor in determining eligibility for a 504 plan. And this is often confusing in schools. So perhaps once a week, I get an email from a family that says, my school says that my son or daughter is doing too well academically, and so they don't qualify. It actually doesn't matter how your child is doing academically. They have a disability with celiac disease, and there have to be accommodations for them. They could be a straight A student, they could be a straight C minus student. It doesn't matter. Their ability to have accommodations for celiac disease specifically have no bearing on their grades. A 504 plan also stays with your child from the point that you set it up all the way through college. So it should travel with them even if you move school districts as you go from elementary, middle school, and high school. If you move states, there will likely be a new form that has to get filled out, but they would transfer the old plan to the new school and the new state requirements. An individualized education plan, or an IEP, is a different type of educational plan. This type of plan is meant for a child who has a documented learning disability that truly impacts their academic performance. So things like dyslexia, ADHD, autism, visual impairments, or speech and language difficulties, to name a few. In order to have an IEP, your child must have one of those 13 learning disabilities. However, if your child has celiac disease and an IEP, you could combine the accommodations for the learning disability with celiac disease. The IEP is going to have measurable animal goals and objectives that the school is looking for to help improve their academic performance. You could include celiac disease accommodations in this plan. The only thing I will caution you of is that if your child, hopefully they will overcome their academic challenges and will eventually roll off an IEP. If this happens, obviously celiac disease is forever. If the IEP ends, you would need to make sure to then transfer the celiac accommodations to a 504 plan because unfortunately, we do not grow out of celiac disease. And as of now, the only current treatment is a gluten-free diet for life. So if you do roll off the IEP, make sure you get that 504 plan in place. The third type of plan offered in schools is an individualized healthcare plan or an IHP. This plan is really meant to deal with medical issues that occur in the school setting. It's designed to be used by a school nurse or a health aide and is really not the plan to offer formal classroom and cafeteria accommodations. This plan is meant to be reactionary. So, what happens if your child is sick at school? For example, a child with a food allergy, if they are having an anaphylactic reaction to something that they've eaten or been exposed to, what should the nurse do? Should they administer an EpiPen? Should they administer prednisone? Should they be giving them Benadryl? It's a reactionary plan as opposed to being proactive. The 504 plan is proactive, where we're developing accommodations to prevent a gluten exposure. Um, the other big difference is that a 504 plan and an education plan are both legally enforceable plans, whereas the individualized healthcare plan is not. And so it does not have the same protections that a 504 plan or an IEP would have. The only time we really see an individualized healthcare plan for celiac disease is when it's an addendum to a 504 plan. So, if your child gets extremely nauseous with a gluten exposure and you want them to be able to take a medication in the school setting, you would write that into the healthcare plan that's attached to a 504 plan. If they have a food allergy and they also have an EpiPen, there would be an accompanying IHP to talk about administration of the EpiPen. But in general, we don't want to see a child with celiac disease with a healthcare plan alone. So, how do we get to the accommodations? Well, it starts with the celiac disease diagnosis. Once you have that diagnosis, it's extremely important that you get a very detailed letter from the diagnosing physician describing your diagnosis. But most importantly, in that letter, we want to make sure that your doctor has actually said that they want you to have a 504 plan. We have really wonderful template diagnosis letters. I know the University of Chicago does a great job, but if you're a family that is not affiliated with them and you see a gastroenterologist outside of the University of Chicago, make sure that that letter specifically asks for a 504 plan and accommodations in it. Then you need to let your school know. So the most reasonable place to start is to email the school nurse or the principal to let them know that your child was diagnosed with celiac disease. And in that initial email, request a 504 plan meeting. Let them know that celiac disease is a disability and that your physician told you that your child should have a 504 plan. That is your request, and they have to honor that request to have the 504 plan meeting. At that first meeting, it's likely going to be called an eligibility meeting or an eligibility hearing. And I know that language can be really intimidating and scary, but the good news is that they're going to ask you two questions. Those questions are, does your child have a disability? Yes, celiac disease. And what are the major life functions that it impacts? Eating, digestion, immune system function. You only need to answer one of them. One major life function is enough to qualify for the 504 plan. And so that part of the meeting actually goes by very quickly. Eligibility or meeting or eligibility hearing, these are just the terms that the laws have given them. And even though it feels a little scary and uninviting, these are just words that your schools are required to use. So don't feel intimidated by them. Once you've gotten past the eligibility piece of the meeting, you'll go on to talk about the different types of accommodations that you think your child will need in the school setting. Different people within the school will be assigned roles, the plan will get written, you'll be needing to sign off on it, and then the plan will get put into action. At a minimum, you're required to have an annual check-in to update the plan. We recommend that you do this at the beginning of each school year. And we also recommend scheduling this meeting early. Do not wait until the week before school starts to send a note to the school asking for your 504 plan meeting. Do it as early as possible. Also, if you have a child that's entering kindergarten, it is so important to do this at the time that you register for kindergarten. So Right now, many of you should probably be registering your kids for kindergarten for the next school year. Make sure that right now you are letting them know, and then make sure that as soon as you get your teacher list and assignment for the next school year, that you reach out to that teacher. So many times I've been in 504 meetings for kids who are kindergarten, first grade, second grade, and the teachers have no idea until the first day of school or until that meeting actually happens, which could be a week or two into the school year. All of the teachers say that if they had known before they ordered school supplies for the year, they would have planned differently. And so, especially in early childhood where they're using lots of Play-Doh and finger paints and materials that might contain gluten, letting your teacher know as early as possible can really shift the entire dynamic of the year if they're able to set up their classroom with materials that are safe for everyone to use. So, don't wait until the last minute, do this early. This will also help your healthcare team. When I was at Boston Children's Hospital, we used to get thousands, probably more than 1,000 requests for updated diagnosis letters the week before school started in September. And this was an absolutely chaotic time for all of us. And we could not, of course, accomplish 1,000 letters in a day when they were requested. And so request those letters early. You know that you're going to need them for the upcoming school years. And so please reach out to your healthcare teams as early as possible to get those updated letters. Typically, schools require a new diagnosis letter every 2 years. And this varies by state, but just make sure you know what that time frame is and give plenty of time for your health team to get that letter back to you. So up on this screen is a very small 2 pages, but I put these 2 pages here because I'm hopeful that you will download those national guidelines that I talked about, and maybe Rachel or Lindsay could put a link to those in the chat. On pages 20 and 21 of this document are all of the approved accommodations that the group came up with. I'm going to put, this is just blown up from that. So there's 2 pages, and on each page, it's broken down between 3 different parts of school. We have classroom and other learning spaces, eating spaces, and then field trips and offsite activities. And so the accommodations are broken down into these different categories. There's also a Word document that Rachel and Lindsay can put a link in the chat to as well, where you can download a sample 504 plan. I'm going to walk you through that document in just a minute, but all of these accommodations are listed in that Word document, and so you can cut and paste the ones that you think are actually necessary for your child. What I'd urge you not to do is to just copy and paste the entire document and hand it to your school. I guarantee you every single accommodation listed here is not necessary for every single child. I've actually never had a single child I've worked with that needed every single one of them. And so instead of giving your school a very long list of every single accommodation, take a few minutes and be really thoughtful about it. Go through that document and say, which of these does my child actually need and really applies to them in their school environment. Also, add in your child's name. You'll see in the template plan, we've highlighted places where we think you should include your child's name, but make it personal. As you'll see, in this document, all gluten-free food options served to children with celiac disease. Change that. Make it all gluten-free food options served to Brandon. Must meet blah, blah, blah. So that it's personal to your child and to your school. Put in the name of your school. Put in your personal contact information. Put in your child's name so that it's personal and it's about them. So here's some examples of accommodations that are reasonable and unreasonable. So in the classroom, we would like to see naturally gluten-free learning activities, or if there is an activity that contains gluten, make sure there's a safe gluten-free option for the child with celiac disease. And we want them to talk with you, the parents, about how they're going to accommodate for specific lessons. I am a parent of a child with celiac disease. I was diagnosed with celiac disease 20 years ago, and I have a 10-year-old son with celiac disease. And it's a really awful feeling to get, or for my son to come home at the end of the day and say, Mom, we had something with gluten in it. I don't know if I was really exposed to it or not. It does not feel good. And I'm sure many of you have been in that situation yourself before. And so it's really important to ask for them to talk with you about what those accommodations are, so we don't have these awkward afternoons where we're wondering if our child may have been exposed to gluten. Things that would be unreasonable. We do not want to see excused absences from the classrooms or extra study hall periods. The goal of the 504 plan is inclusion. We want your child included in every hands on learning activity that their peers are doing. Oftentimes, I'll get these plans back and there'll be an accommodation. If there's gluten use in the classroom, Joey can go to the library and watch a movie about the same topic or read a book. So we can all agree that reading is very important. But what we don't want is we don't want Joey being taken out of the hands-on learning with his peers to be reading instead because of his celiac disease. We want him included in the classroom. Extracurricular activities, things that are reasonable. If they are providing food to other students, there should be gluten-free options for the child with celiac disease. And if there is food, we want them working with you, the parents, to identify what that food is and how your child is going to get it safely. Things that we don't want to see is denying your child access to participate in that activity. There are always a number of questions about after school programs that come up during this class, and so I want to address it now. So there are different types of after school programs. There are some after school programs that are part of the actual school program that are offered and open to every student in the school community. If that is the case, then accommodations would be made under the same 504 plan for that program. But if that after school program is just an outside independent contractor that is renting space within your child's school, it probably will not fall under the same 504 plan. So it's really important to understand how those programs are administered, what the payment structure is, and what the offerings are globally across your school to really understand whether or not they are required to accommodate. When it comes to things like the parent-teacher organizations, school festivals, if your school is endorsing and promoting those events, then they should fall under the 504 plan because it is an activity or service that the school is offering to all students and families who are affiliated with the school. So in the cafeteria, as I mentioned before, the gluten-free meal should be a hot meal for a hot meal and meet the same nutritional and caloric values as meals served to other children. Things that we would consider unreasonable, exact matches. So we're likely not going to see gluten-free ravioli to replace regular ravioli. However, gluten-free pasta is now being served very regularly in schools across the country. And so pasta would be a reasonable accommodation. As I mentioned before, we can't ask for the entire school to go gluten-free. And we also can't ask for a separate kitchen and equipment for gluten-free food preparation. This will just be completely unreasonable of a request. We can ask for the school to let us know how they plan to safely accommodate a gluten-free diet in their school cafeteria. We can ask them what their protocols are for cleaning, for preparing food, for sourcing food. We can make sure that they have a reasonable plan in place to prevent cross-contact with gluten, but a separate kitchen or separate equipment would not be a reasonable request. For field trips, we want them talking to you and engaging with the parents and guardians in the planning of the field trip well in advance. It's very reasonable to ask for you to be able to chaperone the trip if food is going to be involved in it. And if the school is providing food to other children, they should also be providing gluten-free food for the child with celiac disease. So, what are some practical ways to accommodate the gluten-free diet in the cafeteria? So, of course, naturally gluten-free meals are a great way to go, serving things like fresh fruits and vegetables, lean proteins, potatoes, corn, and rice. Offering gluten-free bread for sandwiches, having gluten-free buns for hamburgers, hot dogs, and grilled chicken sandwiches, using cornstarch to bread all fried foods. And actually, a number of schools in the Northeast have actually started using chickpea flour to bread their fried foods to make them all gluten-free. For French fries, tater tots, and hash browns, do them in a dedicated fryer so there's no risk of cross contact. Use corn tortillas for Taco Tuesday. This is actually a really simple substitution so everyone can eat those same tacos. Order pizza from a vendor that has a gluten-free pizza option, or keep gluten-free pizzas frozen in the cafeteria. There are lots of food service companies now that have different pizza options for schools, whether it's just the crust alone. There are also bacon and bag pizzas that come already with the toppings on them. So they just pop the bag right in the oven and there's no risk of cross contact whatsoever. using gluten-free soy sauce and sauces and marinades, having things like veggie chips, potato chips, or corn chips for snack options, squeeze bottles for condiments, and picking a food service supplier that offers many gluten-free options. So sometimes schools will say, oh, I can't source that. We can't get gluten-free bread. I can't get buns. I can't get pasta. Most often, this is just a communication issue, or they haven't actually gone in to look at what they can get. And I would encourage you as parents that if you see holes in what your school is offering, to set up a meeting with the food service provider and have a conversation with them. Um, a real life example in my own life, last year, my son was getting a little annoyed that once a week for lunch, they would have breakfast for lunch, and his friends would have the choice of muffins or pancakes. And his only choice was gluten-free toast, but they would give it to him just straight out of the bag. And so it was just room temperature bread. And as we all know, gluten-free bread is much better when it's toasted or warm. And so he very much did not like that day for lunch. And so I set up a meeting with the food service provider, and she pulled up her ordering list. And we actually found gluten-free muffins, two different flavors of them, and pancakes that were not only gluten-free, but also dairy and nut-free, that met their exact price requirements for all the other ordering. And so now they have gluten-free muffins and gluten-free pancakes available on breakfast for lunch days. It wasn't that our school was intentionally not offering them. It was that no one had ever asked, and they had never thought to even look to see if those options were available. And so I would encourage you to have a relationship with your food service provider, the food service manager, the dietitian, whomever is responsible for ordering foods, and to go meet with them regularly if there are things that your child wants. I would also recommend that at the holiday times, when you're sending in cards or little treats for your child's teacher, add the food service provider to that list. A little bit of TLC can go a long way in these relationships. So, what is your food service provider's actual responsibilities? So, if there is a student that has a medically required diet like celiac disease, they are required to make food substitutions or modifications for any student with a disability. These must be documented in that physician letter. So your doctor must say that you need gluten-free food to manage celiac disease. So again, this is one of the reasons that having a really comprehensive diagnosis letter is so important. These regulations that I'm putting up right now come straight from the USDA under their Whole Food Service Division. And then they cannot charge you a higher price. So if you live in a state where you have to pay for school meals, the school is not allowed to charge you an additional fee for the more expensive gluten-free food. You are only obligated to pay the same price as what other children are paying for that school meal. So this is a really important point. We have people all the time saying that my school is charging double for the same meal that other students are paying half for. This is actually not allowed. And so you can always cite these documents from the USDA about how they cannot actually do that. So, as I mentioned before, there are 8 states that currently offer universal school meals, meaning free breakfast and lunch for all students, regardless of income or qualifications. Again, it's Massachusetts, Maine, Vermont, California, Colorado, Minnesota, New Mexico, and Michigan. Within these states, a gluten-free meal option that meets the same nutritional requirements as food served to other students is required. You cannot be charged for these meals. If food is offered to other students, you must have a gluten-free meal offered. Suggesting that the school cannot safely feed your child is not allowed. So oftentimes you'll meet with the school nurse, and the school nurse will say, yeah, I guess we have to accommodate, but I wouldn't suggest that they're going to get sick at school. That's actually not allowed. They can't do that. The school is required by law to find a safe way to provide food to students with a disability. I have done in the last year over 600 504 plan meetings with patient families, and any student that has wanted to eat at school is able to eat at school. Sometimes it takes a little bit of extra work and education for the school to get the right protocols in place and the right food in place, but it is possible. If your school is not offering gluten-free meals and your child wants to participate, please reach out to your physician for support. This is really something that they can get involved with in supporting you at school, just like they would support any other patient who needed medicine in the school setting. Now, if you don't live in one of those 8 states, but in one of the other 42, the requirements are not all that different, except for that it's not free every single day. So again, a gluten-free meal option that meets those same nutritional requirements is required. You can't be charged more. You can't say that the school can't feed your child or that they can't safely do it. They have to find a way. And again, if your school is not, reach out to your physician for support. They can be really helpful here. And if you are enrolled in a free or reduced cost meal program in one of these states that doesn't have universal school meals, again, those programs, back to the National School Lunch Act, they're required to provide a gluten-free meal for your child with celiac disease. So these are just some other helpful resources that are in that handbook that I mentioned. We have a gluten-free school supply list, recipes for modeling clay and paper mache, a whole classroom substitution list. So where you have materials that might contain gluten, these are suggestions for materials that are gluten-free. And then there are tips for when your child gets a little bit older into high school, where they might have family and consumer science classes or home economics classes. We have ingredient suggestions, safety measures to consider, and then research to back up all of the reasons why we say that schools should do this. So as I mentioned, this is a sample 504 plan, and we do have a Word document that you can download and fill out to share with your school. This plan goes through all of the details that your school would need. Sometimes a school will take this document after you've filled it out and everyone will sign it and it will simply go into effect. The majority of the time, the school is going to take this plan and copy and paste into their own 504 template, but preparing this in advance really does help your school. Most often, the reason for pushback on a 504 plan is that it's more difficult to put together than a health plan because there are all these sections that have to be filled out. By filling out this sample plan and sending it to your school, you're doing all of the hard work for the school and making their life a whole lot easier. So basically, you're going to go through your child's demographics, their date of birth, the purpose of the plan, an explanation of celiac disease, and an explanation of the gluten-free diet. Then you get into all of the different accommodations. So this is the Word document that I was talking about. So as you can see in here, the family went through, they put in the name of the food service provider. They put in the child's name and changed it to Brandon's parents. Do not serve Brandon packaged food unless it has a gluten-free label. So making this very, very personal so that it's actually about the child and not just a mystical student with celiac disease. And again, it's broken down into 3 sections: the classroom, eating spaces, and other activities. This is the last section. And so this is a plan for a gluten exposure, which should be in every 504 plan. What I want to caution you on here is that depending on how your child reacts to being exposed to gluten, this part of the plan will look a little bit differently. For most children with celiac disease, this is an easy add-on sentence to the end of a 504 plan. If your child has coexisting food allergies, if they have extreme vomiting or nausea, and there is a note from your physician to provide them with medication, sometimes they will want to put this into an accompanying health plan, and that is absolutely okay, as long as it is written somewhere how to help your child if they are having a gluten exposure in the school setting. So I want to go through some of our frequently asked questions. So the first one, my child's school says that they don't offer gluten-free food. So as I mentioned, if your child attends a school that participates in the National School Lunch Program, they are required by law to provide a gluten-free lunch. Most often, if they're not, it's a communication issue. Most often, school nurses and vice principals or principals are the ones who are administering the 504 plan meetings. And most often, school nurses and principals have no idea what happens in the cafeteria. That is their time to be away from students, and they are typically not in the cafeteria. And so oftentimes they just have no idea what the food service provider does. And so that's why I think it's so important that you meet with the head of nutrition services and the cafeteria manager to really talk through these things. They're the one preparing the food, ordering the food, and know what happens there. Even though nurses and principals are extremely well-intentioned, they often just don't know what's being done in the cafeteria. So make sure to loop in those nutrition services folks so that you get all of the right information. My child's school says no to a 504 plan. So if your child attends a school that receives federal funds, they are required by law to hold that eligibility meeting. As I mentioned, all students with celiac disease qualify because celiac disease impacts major bodily functions. Kindly remind your school that celiac is a disability and that the 504 plan is the most appropriate plan for documenting those accommodations. Again, if you continue to have trouble, get your doctor involved. The school has to follow what the doctor says in that diagnosis letter. And so putting the words, please have a 504 plan for this child is really important language to have in that diagnosis letter. My child keeps getting exposed to gluten at school. As a mom of a child with celiac disease, I know how frustrating this is, and it makes your blood boil. And it's an awful feeling for your child to get sick at school. But if this is happening, you really need to be proactive and set up a meeting with the plan administrator, the nurse, the teacher, and the food service manager to have conversations about what is happening and how this can be prevented. So, if your child knows where they're being exposed, you want to talk through how those exposures are happening, and then you want to ask for in writing a prevention plan. So, how are they going to prevent these exposures from happening going forward? I will tell you that at some point, no matter how good your school is, there will be a time when your child will be exposed to gluten. There's gluten in the world and it will likely happen. So, as best as you can, try and remain calm, help your child get through the exposure, and then set up a meeting where you can really talk about how you're going to prevent these things going forward. So, let's talk about going to college. So, accommodations look slightly different in the college setting, but not all that different. So, your first step when you get to college is to meet with the Office of Disability Services, where your student is considering going to college. You want to find out how they plan to accommodate celiac across the campus. Once you've actually selected your college, you're going to submit that existing 504 plan to the Office of Disability Services. It's going to look different because you're probably living in a dorm room, you're going to have dining hall plans, and there's a lot of different pieces that go with living away from home. So it's going to look different, but a lot of the same rules apply. Also, as your child prepares for college, every year the Society for the Study of Celiac Disease hosts a college summit where there are also college scholarships that are offered. So be on the lookout for those as your child gets older. They typically happen in April. This one happened just last week, but they will be offered every year. So keep an eye out for those announcements coming up in years ahead. So what are some of those accommodations? Just like in K through 12, we want to see gluten-free food in the dining halls that meet the same nutritional standards as food offered to other students. If it is an option, we want to see students able to pre-order so that they know what they're getting and when. We want foods to be easily labeled so that they can identify gluten and other common allergen. We want standard cleaning and preparation practices so that the gluten-free food is prepared free of cross contact. We want them to have regular training. Most schools, this is happening on a regular basis, but we want to make sure that they're reminded of the importance of gluten-free food preparation and safety standards. We like to see a dedicated space in the dining hall that is used to store and prepare gluten-free foods, using vendors that accept the students' prepaid meal cards for these gluten-free options. And then in the dorm room, things like having your own refrigerator and microwave. So, most often these microwave refrigerator units are pretty small, and we know college kids can be pretty messy. And so it is very reasonable for a child with celiac disease to ask to have their own refrigerator microwave combo unit in their dorm room. Again, work with your physician, work with your team. University of Chicago has great transition programs. And then be sure to look out for the Society for the Study of Celiac Disease's annual college summit. It's an amazing program that all kids who are transitioning to college should attend. So what are your next steps? After today, you want to make sure to reach out to your child's physician to get that diagnosis letter, review the voluntary recommendations for managing celiac in learning environments, and start thinking about the types of accommodations that your child would need. Connect with your school nurse or administrator to get that meeting set up in place. And we have many, many resources, both at the University of Chicago and at celiac.org. So I'm going to pause here and open it up for questions.
Vanessa, that was amazing. And I apologize earlier that somehow technology is not my friend. But I wanted to give you everyone, a proper introduction to Vanessa. I know Dr. Verma, you might have, but with your new role, Vanessa, as Chief Education and Community Engagement Officer at Celiac Disease Foundation, we are so thrilled to be working with you on a deep level. As everyone knows, across the country, the celiac world is small and a very tight community. And we have had the pleasure of working and collaborating with you while you were at Boston. And now we are so excited because we are expanding upon other national initiatives with the Celiac Disease Foundation. I know Vanessa mentioned some of the organizations when she opened up, but we are really excited that this program that Vanessa just presented will actually be offered monthly. And so if it's a great place to, we're going to address your questions, but these classes monthly when they're offered, great place to have questions answered if you want to jump on. If you're transitioning schools next year, all of a sudden you're heading to junior high or high school or even college, it's a wonderful place to, again, revisit some of this information and get questions answered. But it is amazing to have such an incredible expert like Vanessa here with us. So Vanessa, I just wanted to there are some questions here that I know we're trying to answer some, but you just kind of left off on college. So I want to revisit that. Can you talk a little bit about safe housing and your recommendations? I know to start with the disability office is a great place to start. With this family, what are the next steps? Once they've registered with the disability office, how do they address the housing issue if there are special housing requests and things to go through?
So first and foremost, and I think Dr. Verma and I very strongly agree on this message, is do not let housing, do not let roommates, do not let your celiac disease dictate where you go to college, who your friends are, or where you live. Gluten is part of the world, and you don't have to necessarily live with people that have celiac disease in order to be safe in the college setting. You will have friends in your life, some who have celiac disease and probably many more who don't. And so it's really important to build relationships organically and really work with have open and honest communication with your roommates and, find a way to live together that really works. These are, helping to build life skills in college that are really, really crucially important. I would say things that are important from the initial setup of housing is if you're going to live in a dorm room that has a kitchen in it, think about things like talking to your roommates early on to plan how you are going to keep things safe and separate. Washing does work. We know that you can wash pots and pans and utensils and live in a shared space. But if that makes you uncomfortable, having your own set of cooking equipment, totally okay. If you're living in a dorm room, most freshman dorms do not have kitchens. Like I mentioned, having your own mini fridge and microwave is a really reasonable request for a child with celiac disease. Those things get really, really, really dirty, regardless of your dietary needs. And so it is perfectly acceptable to ask to have your own. And I've never had that request denied before. Meeting with the food services team across the university is really important because there may be really good gluten-free options in one dining hall, but not the other. And so you want to know where you're going to have to go to get that food and where your options are in advance. Do not wait until the last minute to try and figure these things out. It is appropriate to ask these questions as you're attending Admitted Students Weekend. It might help you make a final decision on where you go to college, but it should not be the only factor in determining where you go to college. Truly, college is the most amazing time. I was diagnosed with celiac when I was in college, and so I remember it very clearly. And I did not have a super awesome dining hall staff that made accommodations. But again, this was 20 years ago before it was much more prominent. But it's really important that you pick a school that's the right for you academically and socially, and we will figure out all of the rest.
Absolutely. Such great advice. And I know my daughter recently committed to college, and the first call we made was to the disability office to register 504. So I highly encourage do it early and fast, like Vanessa said, so that you can get all your questions answered before the rush of orientations and things like that. One question, Dr.
And I
Verma.
just want to add,
Oh,
to that, involve your children in that decision making. Don't make all the decisions yourself. You can guide your kids whichever direction you want them to go to, but I think it's really important to get their buy-in as well. Have them stay with their freshmen. Don't put them in a dorm that is more for the seniors. It's just not going to be a good experience for them. And if the children are having difficulties, then they should lean on their clinical team. It's very important for us to empower. I don't know how many children are on this today, but I think it's so important for us to empower our children. It is so, so critical that they learn that they are the people now in college that will reach out to us as the clinical team, and lean on your clinical team. Let them help you work through that, and let it be a great experience in college. And the same thing in high school and middle school. Involve your children as you get through your 504s.
Yeah.
Absolutely. This is a lot of work to put together. And if your kids don't know what the accommodations are or aren't part of the process, they're not going to use the accommodations. So make sure they're an active part of it.
Absolutely. Well, Dr. Verma and Vanessa, while you're both on and just speaking, I wanted to ask you, are there options to get assistance if a child is gluten sensitive? And would, Vanessa, you were talking about the letter, the diagnostic letter. Would a doctor put together a letter if the child is not diagnosed with celiac? How does that work for celiac or gluten sensitivity?
I think you first have to have the diagnosis made. Obviously, the clinical team cannot say celiac disease and it's not celiac disease. So that's really important. As Vanessa said, first the diagnosis needs to be established. If the diagnosis is gluten sensitivity, then you've got to work with your clinician in terms of how was that diagnosis made, and then the clinician puts in the accommodations that are reasonable. But then you cannot, most of the people diagnosed with gluten sensitivity, there's a different accommodation level from a celiac disease patient. But that's a conversation to be had with your clinical team, your child's symptoms, all of that would be there. Just like any other accommodation. You know, if someone has irritable bowel syndrome, for example, they have their accommodation and you work with your clinical team. Someone has Crohn's disease, that's again an accommodation that's needed. So this 504 or disability is not exclusive for celiac disease. It is for any chronic disease, but you've got to work with your clinical team and they put those accommodations together.
That's great. Vanessa, do you have any? Go ahead.
I would just add on. So there's another question in there about wanting accommodations for no food that contains oats. So the requirement is that they provide a gluten-free meal, not the exact meal in which your child wants to eat. And so we can't ask them, it's like, oh, my child doesn't like this or my child doesn't like that. But if your doctor is working with you to manage the gluten-free diet and they have told you to avoid oats, then that is something that should be included in that diagnosis letter from the physician. And then they would need to honor it the same way that if your child has celiac disease and also avoids dairy. So that would also need to go in the letter from the physician. But if you as the parent just went to the meeting and said, oh, we don't want anything for our child nothing gluten-free that contains oats, they would not need to honor it unless it is part of the physician's letter saying that they medically need to be avoiding oats as well.
Fantastic. So our next question we have in here is how do you recommend handling if the family does not want the school's recommended or preferred accommodation? For example, an allergy lunch table the kids are required to sit at. The school insists that they utilize that lunch table for safety. How does the family navigate that?
Yeah, so that's a challenging and tricky situation that really is school dependent. In general, I would 100% advocate against the allergy table because it is not required or necessary for celiac disease. Your child can sit at any table and as long as they're eating their own food that's gluten-free and not sharing with their friends, there's no reason for them to be sitting at an allergy table. On the flip side of that, I will tell you that there are a lot of schools that have a large number of students that have medically restricted diets, and it can become a huge burden on the schools to be managing all of these children, and especially in like K through 2, I have seen them require that the child with celiac disease sits at an allergy table, and that's largely to help the school make sure that the right food is getting to the right student safely. In these schools, the meals are often served to the kids at the table. So the kids all come in and then somebody is bringing the food to the table as opposed to them going through a line. And so it helps the school make sure that mistakes aren't being made. And so I think that it really depends on your school's process overall and how they are ensuring safety of your child. And so first and foremost, I would say they don't need an allergen table, but if that is going to conflict with the way in which the school operates to get safe food to your child, I think that's something that you do need to consider.
And I would add that I think it's important to try and understand why the school is asking for that accommodation that's not needed. And that's probably one of the key things to find out why. And if it seems reasonable, then one goes ahead and accepts it. And if it doesn't seem reasonable, then a conversation should be had. But it's all has to be reasonable accommodations. Otherwise, we will get nothing. So I think it's important to have those discussions and figure out and make them understand, and for us to understand as well, why a particular school is doing whatever they're asking to be done.
Absolutely. And Dr. Verma, while you're on, I want to start with you with this next question about how do you talk to the school about an accommodation for anxiety that goes hand in hand with celiac disease?
So I think it's really important. I mean, we have a lot of children with chronic disease, with celiac disease, that have anxiety. So important that whoever the therapist is who's managing the anxiety needs to be part of the discussions as part of the 504. So I think if someone has the anxiety, what's important is that you are actually seeing a therapist and working through with those anxiety things. So that's one part of it. And we do this often, that we actually have our psychologists and counselors working with us as we get the 504 together. And that's the first accommodation that needs to happen, is that your therapist needs to be part of the team. And then I think it's not unreasonable to ask for that. I think it's quite reasonable. But again, reasonable accommodations is what we want to get at. But get your therapist involved with that. The counselor, the psychologist, whoever you're seeing should be part of the team putting this together.
And I think that, just echoing what Dr. Verma had to say, is really having the therapist and the physician be a part of these discussions can be really helpful. I worked with a family earlier this year where their child was unfortunately subject to some pretty bad food bullying at school, where another child was taking gluten-containing pretzels and croutons and crushing them over the child's gluten-free lunch. And it got to the point where this child refused to eat at school because they just wouldn't, were so afraid of this happening. And the way the cafeteria was set up is that they had assigned seats. And so the child couldn't just go sit at another table. They were required to sit in this place. And so we met with the school, with the physician, and with the counselor. And the resolution that we came to was that they actually created a friend circle for this child. And they had another table where the child was able to pick 3 friends. And so the 4 of them for the first few weeks back sat at this special table to sort of help him feel comfortable in the cafeteria setting again around children that he trusted who would not be glutening his meal. And then after the friendship circle, they ended up switching his place to a different table within the cafeteria, and he's now eating successfully in the cafeteria again. But it did really take stepping back, addressing that child's anxiety, what they were fearful of, and looking for a path to reintegrate them into that setting. So, definitely work with your health team and with the school to come to a reasonable place.
That's fantastic. So I want to get a little clarification. Vanessa, and I think I'm going to put this in the ball in your court on this one. Can you explain the difference between that initial 504 letter with the requests and then the actual 504 plan document? I think we just are looking for a little bit of clarity of, when you go in to request a 504, do you have to have the letter?
Yeah. So
Yeah,
there's
go ahead.
2 different pieces. Step 1 is getting the diagnosis letter from your doctor, and you want to have language in that physician's letter that requests a 504 plan for your child. It makes your life a lot easier because then your doctor's asking for it, and then the school has to, honor it. It is helpful if you have that letter already when you request
Stop at Kroger's.
from the school, so that when it's all started, the pieces are together. when you send that initial email to the school, if you don't have that letter, they're immediately going to write back and say, sure, we're happy to set up the meeting, but in order to do so, we require the physician's letter, documenting this. And so you need the physician letter in order to proceed with the 504 meeting, but you don't actually, if you don't have it when you request it, that's okay. They're just going to ask you for it. And then the 504 plan document will come out of the meeting.
Perfect. And that's what you sign, your child signs. Yes, the school, everyone's.
Child doesn't necessarily need to sign it.
Okay. That's good to know. And then, Dr. Verma, I know there are bathroom considerations sometimes. Is that individual or is that typical within a 504 plan?
It all depends on what the underlying condition is. If your reaction is more lower GI related, then you talk about those, but not every child wants that bathroom to be in their 504 unless they truly have symptoms. And in the context of celiac disease, in the context of Crohn's disease, ulcerative colitis, yes, bathrooms are a big part of our 504. So it depends on what the underlying condition is. And if someone has celiac and Crohn's disease, then you do. But again, have a discussion with your primary team. I could not emphasize more on this. It is so important to have that conversation and not just stop at the school or the college saying, we will not respect this. I know there was a question earlier about the school nurse saying that the child did not need a 504. I'm going to disagree with that nurse. I think every child who gets diagnosed with celiac disease, the year you're diagnosed, you want to start the process of 504, however old the child is. So if your child is having, diarrhea or constipation or any of those concerns, and there is a bathroom that's a reasonable accommodation that's needed, then yeah, then that gets into that level.
Fantastic. Well, this was amazing. I cannot thank Vanessa enough for your time, Dr. Verma for your time, Lindsay for pulling this together. And as you can see, there is a team surrounding all of you. We want to be here for you. Lindsay is here, obviously, for our University of Chicago team. We're here for you. This is every 504 is individual. And as Dr. Verma and Vanessa have consistently reiterated, working with your team, working with your medical team. And then we are here to kind of guide you. There are tons of resources. The school management plan is wonderful. It is such a comprehensive document. We can't recommend it enough, but all of this can be overwhelming, and we're here to hopefully guide you through individually. So please reach out to Lindsay and just know that every month we are going to have these. We will be sending information, but Vanessa, we cannot thank you for your expertise. And it was such a pleasure and a treat to have you today. And honestly, it's such a wonderful thing to have a resource like you in our celiac community. So thank you. Thank you, Dr. Verma. Thank you. I don't know if you want to close it out, but we're just happy everyone attended today.
I think I'd like Vanessa to mention a little bit about our national educational platforms that we have started ongoing, and how everyone in the community, regardless of where you are, whether you're in Chicago, whatever, but Vanessa, perhaps that would be something good for everyone to know.
Sure. So this is perhaps the most exciting thing Dr. Verma and I have ever done together. But Dr. Verma and I have always sat together and thought about how we standardize education for celiac disease nationally, and really get all of the celiac centers working together to be giving the same information to patients that based on data and research and really what is the correct information. And so we've started this national educational collaborative with lots of hospital sites in celiac disease. And so our first effort was to have these school sessions, which will be held monthly. We'll be doing culinary medicine programs. We'll be doing a teen celiac chat every other month, and as well as lots of other fun educational programs. So I'm sure Rachel and Lindsay will make sure that everyone knows about these upcoming events, but we're just really excited to have all of the leaders in celiac disease coming together in a united way. So we're very excited about it.
Yes, we are too. Dr. Verma, we know this has been a passion of yours and Vanessa's, and we are here for it. and just stay tuned. We have so much education coming, and we just are thankful you're here with us today. So thank you, everyone. We'll be sending out all of the resources that were referenced today in a follow-up email, and this recording will be up on our YouTube channel as well. So thank you, everybody. We really appreciate it. Have an awesome day.